You might be kind of curious, why plastic surgeons are involved with migraines. It's just by coincidence, probably about 10, 12 years ago, that a lot of the patients who had these procedures or the Botox injections would come back in and say, you know what, I like the way I look, but by the way, my migraines are better. You look at the criteria for migraines. This is a headache that lasts for anywhere from 4 to 72 hours. You have to have two of the first column where it's either on one side, where it's throbbing, where it's made worse by movement, by putting your head one way or the other, and also it's a severe headache. And then you have to have that plus either nausea or vomiting or the phonophobia or photophobia. And that's where you don't like loud noises, you don't like bright lights, and it's the kind of headache where you just want to crawl into a room, turn off all the lights, put a pillow over your head, and don't anybody bother me. That's a full-blown migraine. Now, the interesting thing about migraines, everybody thinks, well, it has to have certain things. Actually, some people think you have to have nausea or vomiting. Well, you don't. About 30% of the people will have nausea or vomiting. Some people say, well, they always have to have weather changes. Well, you don't. About 50% will have changes in the weather affect their migraine headaches. And then you'll find that some people have it not only on one side, but they will have it on both sides as well. And so you'll have bilateral type of headaches. And then also a vast majority of people will also have some form of associated migraine headaches that will have some neck pain. And we look at who are the surgical candidates. You have some people who fail the medication, meaning they'll have headaches despite taking their medications. They'll take the medication, the headache still comes on and incapacitates them. Or they have other medications they're taking with their blood pressure and other things that they don't interact well, so they can't tolerate the medication to help with their headaches. There are folks who, with the migraines, they'll have significant disability. One gentleman's an electrician. He would get 2 headaches a week, and he'd get so bad where he'd be, his ability to maintain or hold down a job was compromised by his headaches. And then also a good surgical candidate is somebody who's coming in and say, by the way, I always wanted to have my face redone to make it look more youthful. It's kind of like getting 2 birds, 1 stone. They look better, plus they're feeling better. And then also you're looking for a good surgical candidate who responds to the Botox. Again, we have them keep that diary for about 4 to 6 weeks, trying to identify that trigger point. Once we do that, we also try to define what kind of functional difficulties they're having, like how much time off from work are you having. Once we define that, we do the Botox, have you keep the diary again to see if there's a difference from the pre-Botox till after the Botox. And if it looks like there's a good chance the Botox has a good response, then we go on to the surgery, and then we have you do another diary to see how much the surgery has helped. If you do the Botox and you see that there's a good 50% improvement, there's a good chance then the surgery would work well for you. And that's the whole purpose behind the Botox. Again, the 4 major areas for the surgery is across the brow area here. This is probably about 50-60% of the time. There's a little nerve that comes out over here on the muscle that you can clench down with your teeth and you can feel it kind of contract or tighten up. There's another little trigger point where the nerves come out. There's a spot in the back of your head that has some very tough structures around it called fascia. And if you loosen that fascia up and free up that nerve in the back of the head, that is very helpful as well. And then probably the 4th one, again, is the septal area. And that's the area in the nose that sometimes can initiate a migraine as well. The surgery itself is one that's usually done as an outpatient. The vast majority of the time we do under a general anesthetic, but sometimes we just do IV sedation. And most of these incisions are hidden up in the hairline area. Just like with any surgery, there are some risk involved with the surgery, just like with any small cut in the skin, small risk of infection, small risk of bleeding, but for those, you're probably talking less than 1 to 3% risk of something like that. A risk of incomplete relief, that's why we take the journal or the diary afterwards to see what kind of relief we get. Post-operative care is usually pretty simple. I always ask people to keep their head elevated to try to reduce bruising and swelling for about 7 to 10 days. And most people could return back to work in about 1 to 3 weeks, depending upon their job requirements. Again, we have you continue the post-operative diary to see what kind of effect that the surgery did have on you. And then we follow up for like a whole year just to make sure that as things heal, you don't get scarring that might initiate those nerves getting tugged on again.